Welcome back to Save Your Thyroid with Jennifer Holcomb, the podcast where we unpack the latest advancements in thyroid health and patient-centered care. If you've been diagnosed with thyroid nodules, you've likely been told your options are watch and wait or surgery, but for so many patients today, that's not enough. You want to know the root cause. You suspect that your thyroid nodules or your thyroid issues are just one part of a much larger puzzle. What if other conditions like high blood sugar or type 2 diabetes are directly connected? And if they are, how do you find a path not just to treatment, but to lasting health and vitality? The good news is that an integrative approach blending traditional endocrinology and functional medicine can address these connections. With the marriage of this with innovative, non-surgical treatments that can not only preserve the thyroid, but also allow the patient to focus on their whole body wellness. To help us connect these dots, I'm so excited to speak with Dr. Ahmet Ergin. Dr. Ergin is a board-certified endocrinologist and thyroid expert with a deep passion for advanced, non-invasive thyroid nodule treatments. He is a true pioneer in integrating cutting-edge endocrinology with functional medicine principles at his practice, the Diabetes, Thyroid, and Hormone Center of the Treasure Coast. His mission is to offer minimally invasive outpatient procedures like radiofrequency ablation that preserve thyroid function and help patients avoid unnecessary surgery. His approach combines precision diagnostics with hormone balance optimization, all tailored to an individual's metabolic needs. Dr. Ergin is also the founder of SugarMD, a leading educational platform with a massive global following across YouTube, Instagram, and TikTok. Through his patient-centered content, he empowers millions to take charge of their health with accurate, actionable knowledge rooted in both science and compassion. In this episode, Dr. Ergin will help us better understand the surprising link between insulin resistance and the development of thyroid nodules, who makes an ideal candidate for RFA, and when to consider it even if you don't have thyroid symptoms, why he created his SugarMD platform to simplify complex medical topics, and how patients can control both their thyroid and metabolic health. Dr. Ergin, welcome to the podcast. I'm so thrilled to have you here today.
Thank you, Jennifer, for having me. I'm happy to be here.
I have actually been binge watching your YouTube channel because I just thought this is so cool. I actually have never interviewed someone else who's got a presence on YouTube. And I thought, well, I need to get to know this person and see what they're about. And your content is excellent. So I'm excited to talk with you and maybe even get a few tips from you if you don't mind.
Of course.
But yeah, so your practice, I'm very, very intrigued by your practice, just watching your content online, being very unique because you're blending traditional endocrinology with an integrative and a whole person approach, which honestly, so many patients today will find very refreshing, myself included.
That's right.
So I would love to know what led you down this path just beyond conventional treatments.
Great question. Thanks for asking that. So the reason was that I was not satisfied with the options that I was offering to my patients. I realized soon enough, after going into real practice by yourself, you realize soon enough that the conventional medicine that you were taught in the medical school and residency and fellowship all those years, it is very frustrating to see a patient unsatisfied, unhappy, leaving the office not happy because you could not offer any other option other than what conventional medicine offers. So that led me to thinking, what else can there be that I can help my patients with? And I'm open-minded, so I always listen to my patients. I'm not the type of dismissive type of doctor who will say, oh no, those supplements don't work. Oh no, lifestyle doesn't matter. You will be diabetic rest of your life. I wasn't the kind of doctor anyway, and I listened to their stories, and it intrigued me to listen to them saying, hey, I drink this bitter melon tea and my blood sugars are better in the morning when I do that. Normally, a conventional medicine doctor will say, oh, well, I don't see any evidence. I wasn't told about this, so I don't think it is true. Just take your glipizide and take your insulin and be happy. But I listened and I studied more, and eventually that led me to take actually official functional medicine courses. That was like almost going to college again. But that I think made a difference in my practice. And now I can see how much happier the patients are, knowing their options are not just limited to what is offered by insurance only or, conventional coverage.
Well, let's talk about your YouTube channel because you're well known for that. And I believe it's just excellent content. And I would love to know what your inspiration was for doing that. Did you see from your experience, as you were just recalling, with patients being frustrated, did you see a gap in patient education that you wanted to fill?
Yeah, that was the biggest issue. And to be honest with you, it is difficult to try to sit down with a patient for an hour to try to educate them for their diet. And then even if you did that 20 times a day, which is kind of burdensome for a physician, and then hiring the diabetes educators and all that is costly. But the bottom line is, even after all that, the patients go home and they just forget about everything you said. Statistically speaking, people retain only 10% of the information that they hear. And if they even listen, right? So, and they're also under stress. They are in the doctor's office. They're under pressure, so they do not retain all that information. So I was thinking, okay, what can I do for them to feel comfortable so that they don't feel judged and they're just at their home? So I started making these videos, and primary purpose was to educate my own patients. And obviously, it took off, and then YouTube requires consistency, so I put a lot of effort and work to it to try to keep up with posting 2 to 3 videos or more every week. But people appreciated that, and it is great to hear people's stories that without touching them, you're able to change their lives, and that's a big thing for me. I'm so proud of that and happy that I'm doing this, and I will continue to do so.
I can relate to that experience as well. I started the Save Your Thyroid community 6 years ago, and I was doing a lot of the same as what you were describing. I was explaining things over and over to patients. And finally, I was like, I could do this so much more easily by just creating a video that I could point patients to, and that they could watch that on their own time and rewatch it if they needed to. I think it's really helpful to have that kind of evergreen content. For those of you who know the YouTube terminology, evergreen is content that you can come back and watch over and over and over again. It's always going to be good. And, have that resource available. So that's so wonderful. This platform of yours about primarily diabetes education is so important because these stats that I'm going to quote are mind-blowing. On one hand, there are over 135 million Americans with diabetes or prediabetes. And some studies say 9 out of 10 Americans aren't even metabolically healthy. On the other hand, we know that 1 in 8 women will develop a thyroid condition. And some estimates show as many as 70 to 80% of adults have thyroid nodules. So I don't think that this is coincidence. How does this national crisis of blood sugar and insulin resistance and what's happening with our thyroids today come together? Specifically, is there a link between insulin resistance and the growth of thyroid nodules?
So to go a little bit back, the statistics look very scary, and part of that is early screening, and I think that's a good thing, right? So instead of knowing that your blood sugar is 300 and get diagnosed because you can't drink enough water and you're always in the bathroom, that is like pretty advanced late stage. It's like diagnosing cancer at stage 4.
Right.
But diagnosing prediabetes or insulin resistance even help people realize, okay, hey, what's going on? Let me just make some lifestyle changes. So that is part of the reason that the numbers are so high. Same thing with the thyroid ultrasounds. With the ultrasound being more available, screening more of the thyroids, you see more and more. Obviously, not every thyroid and not every cyst is important, but that's our job to determine who will need intervention, biopsy, etc., and who will not. But the link between the diabetes and thyroid, or any nodule or any neoplasm, let's call it a neoplasm. Neoplasm includes a benign tumor and a malignant tumor, but still it's not normal. So you're developing a mass, a structure that does not belong. So why is this happening? And there is tremendous evidence behind this that insulin resistance, insulin is the biggest growth factor. It's a big driver of growth of any tissue. I have videos about diabetes having skin tags, as a growth on your skin. And diabetics are more likely, 2 to 3 times more likely to develop cancer as well compared to non-diabetic population. Again, the same reason, insulin resistance. Even breast cancer, women who are insulin resistant will be more likely to develop breast cancer because of insulin resistance, although they're all scared about hormone replacement therapy, which I am totally in favor of. In reality, people are misinformed. People are thinking that, the hormone will cause breast cancer. On the other hand, 95% responsible hormone is the insulin, and nobody talks about their metabolic health.
Right.
So, but yeah, the biggest connection I would say is the insulin connection.
I'm so glad you mentioned that, because 2 or 3 points you actually made really resonate with me. First of all, the point you made about not all of these are cancer, with thyroid nodules. One of the things that we see happen so frequently when new patients come to the Save Your Thyroid Facebook community is they've been newly diagnosed with a thyroid nodule and they're terrified that they have thyroid cancer. No one's taken the time to explain to them that so many of these nodules, as many as 90% of them, are benign. And that a lot of these, as you said, are being detected very early on through imaging studies. Hey, just a quick break to share something I'm really excited about. My brand new website, saveyourthyroidwithjen.com. You can head there to subscribe to my mailing list and stay in the loop about new podcast episodes, videos, and updates in the world of thyroid nodule care. And I'm now offering something new, one-on-one patient navigation services. If you're feeling overwhelmed or unsure about your treatment options, I'm here to help. As a patient who's been through this myself and spent years learning from some of the world's leading experts in thyroid nodule treatment, I can help you make sense of your choices and feel more confident in your next steps. You can learn more about patient navigation and everything else I'm working on at saveyourthyroidwithjen.com. Now back to the conversation. Maybe someone had an x-ray and it came up incidentally, they weren't even having symptoms. And so that is kind of scary when you don't know it's there. And then all of a sudden you find out there's something there that shouldn't be.
Right.
And so it's not that I want to be, triggering doom and gloom in all of our viewers today, but it's just the fact that these are so ubiquitous now, thyroid nodules. And then just as a side note, the thyroid or the hormone replacement therapy comment you made, same. I'm fully on board with that. And I have patients asking me about that kind of as a side thing, because so many patients with thyroid nodules are women. And we see so many women in my age group. I'm about to be 43 actually in a couple of days, who are starting on their perimenopause journey and their thyroid is starting to go out of whack at the same time. This is all connected. So it's just so critically important for people to realize, particularly women, that our hormones are vitally important. We've had a lot of misinformation from the last 20 years over, the WHI, study and all of that, which we could probably do a whole other podcast on.
Yeah.
But yeah, if you're watching this podcast and you have issues like that, if you're a woman in your perimenopause or menopause years, hormones are not the evil thing that they've been made out to be for the last 20 or so years. So do your own research on that. But I would love to circle back to where we were talking about the insulin resistance connection and say, what would you do when a new patient comes to you with thyroid nodules and they have also pre-diabetes or diabetes? Where do you start? What's the prioritization in their treatment plan in addressing their thyroid nodule?
So obviously, thyroid nodule conventionally is treated as a separate entity, and it should be considered that way as well. The number one priority is, okay, does this look any suspicious? Does this nodule require even a biopsy? Does it even require a follow-up? Like today, I've seen a patient who he had a 4 millimeter cyst. There's no need for a follow-up. Everybody has those things, like you said, and not a big deal, not even a follow-up. Yeah. Somebody comes back with a 2.5, 3 centimeter TR4 classification, ThyroIds 4 classification nodule. Yes, we have to get that biopsied right away, and we can get the answers quickly. So we prioritize that. But at the same time, at the same appointment, we are giving them the connection, hey, because they ask the question, right? Hey, doctor, why do I have this nodule?
Right.
My classic answer used to be like, oh, it's your genetics. You're just a bumpy person. So, but it's not the case. It's actually, again, insulin resistance plays a big role. And I try to explain to them and how it is the same problem. It's just in a different spectrum. Most people end up having cardiovascular disease, heart attacks, and strokes even before they develop diabetes at the pre-diabetes stage. And that's what most doctors and patients don't realize, that, if you're a pre-diabetic, I hear that a lot from patients, that my doctor said, just you're pre-diabetic, you're okay, just eat better and all that. But that's not doing it. So, and then these people come back in 6 months with full-blown diabetes. Even if they didn't, that insulin resistance leads to cardiovascular problems. But yeah, we address both at the same visit. It's a great opportunity to put the connection, put the dots together. And then pre-diabetes, obviously a reversal of that will take a few months versus taking care of the thyroid nodule is probably just a few weeks.
Well, in your integrative practice, you're emphasizing lifestyle a lot. And I would love to hear your top 2 to 3 lifestyle changes that you find have the biggest impact on thyroid and metabolic health.
I think thyroid and metabolic, you can put them two together. But yes, so number one is an anti-inflammatory diet. We are exposed to a lot of pesticides, the oils, this industrial junk, and air pollution. All of that is definitely not helping.
Right.
Because when there's inflammation in the body, that leads to insulin resistance. And when there's insulin resistance, that leads to the tumor formation. So reducing that inflammation, and one of the best diets out there is low-carb Mediterranean diet. That has been the most anti-inflammatory, proven again and again in studies. People do keto, which is fine, but keto is hard to do it right. If you do it right, then it's okay. But the diet is a big part of it. The next is sleep. A lot of people discount their sleep, and you cannot really make up for missed sleeps. I tell my patients, if you want to be healthy, you want to be boring. You're going to the bed at the same time, you're waking up at the same time, including weekends, and your sleep has to be very structured. And I give them sleep hygiene rules, which most people never heard of. And because sleep is when your body repairs things, when the inflammation goes down. If you're not giving your body the chance to recover, that adds up. And thirdly, the exercise, right? So the workout. A lot of people don't realize or understand what exercise means. A lot of people will say, oh, at work, I walk all the time, or I walk my dog every day. I'm like, that is, to me, is an activity. It's not exercise. Exercise means your heart rate goes up and you maintain that elevated heart rate for, a certain amount of time, at least 15, 20 minutes a day. That is exercise. And also strength training. A lot of people don't also realize that actually keeping intact, strong muscles are very helpful for your metabolism as well. So I think if there's 3 things, that would be the diet, the sleep, and the exercise should be non-negotiable part of our lives. Not like, oh, if I have time, I'll go. And that never happens, right? I'm traveling, I'll just eat junk, there's always holidays. You can always find excuses, but if you make these non-negotiable in your life, then you will definitely shift to the right direction.
So important. And these are things that people also tend to think are just not as important because they're so simple, right? You think, oh, I just need to sleep better. Surely that can't move the needle that much, but it does. We think about not sleeping well and how much impact that has on us the next day. I know that also can contribute the next day to you being more insulin resistant.
Exactly.
I'm someone who's always struggled to have good sleep. And so I kind of shudder to think the compound effect that's had on me over the years. And I appreciate you answering these lifestyle questions before we get into the thyroid treatment option discussion, because these are questions that I get asked constantly by patients. And, so I really want to point them to your expertise here. So let's talk a little bit about supplements. You do offer supplements as part of your practice. And I would love to know, what are some key nutrients or supplements that you find most beneficial for supporting patients with thyroid disorders or with insulin resistance?
So with thyroid disorders, we really pay attention to having enough vitamin A, zinc, and selenium. Obviously, omega-3 fatty acids and fish oil, etc., are very important as well. Iodine intake is not a common problem unless people have diets that are very high in certain vegetables and or they live in certain areas. But I mean, it's still important because goiters can develop from iodine deficiency. I see that in certain ethnic populations, sometimes more often than not. But I would say the zinc, selenium, vitamin D, omega 3s, vitamin A are the essentials for thyroid health. When it comes to insulin resistance, I always tell patients magnesium glycinate is extremely helpful for sleep as well as diabetes. Zinc is also important because we have zinc receptors actually in the pancreas. And vitamin D is very important. Vitamin D is actually a hormone that has so many functions in reducing insulin resistance, protecting bones, and supporting immune system. Because healthy immune system actually is the essence of staying healthy.
Mm-hmm.
Because people deal with autoimmune problems and inflammation, and that inflammation is driven by the immune system. And the immune system also boils down to your gut. So whatever is going through your gut is determining how your immune system responds. So for that reason, we also recommend our patients that not just vitamins, but also having probiotic foods or probiotic supplements are extremely helpful for their well-being, for their metabolic health.
All things I agree with and do in my own personal life. So I'm loving to hear all of this validation of what I've been doing. So I want to, on a personal note, I want to touch on a specific diet that I want to ask you about because I saw you've done a video about this, about the carnivore diet, about this zero carb approach, because we're thinking, oh, well, insulin, if insulin's too high, why don't we just take all of the stimulation of the insulin, right? And I loved your video on this topic. Patients are asking me again about lifestyle changes. And in my own experience, I was thinking, okay, in the spirit of experimentation, I will try this diet. And I did for about 9 months. And my hope was actually that I have several thyroid nodules. You and I didn't have a chance to talk about this off camera, but I actually had a very large thyroid nodule that I had treated in 2019 and 2020 with 2 RFA procedures and had a great success from that, had a 90% reduction of this very large, like 75 milliliter nodule, which was making a huge impact on my quality of life, detrimental impact. But I do have several other small, like 1 centimeter nodules that have kind of accumulated over the years. And so my thinking was, okay, well, maybe I can shrink these down before they grow any larger. And actually, the opposite happened. I developed new nodules during that time, which was incredibly frustrating because I thought, well, I'm doing all this right. And I also felt really, really great in the beginning. But the longer I did it, actually towards the end of the 9 months, I experienced really detrimental effects on my sex hormones. All of my sex hormones started to crash. So from your perspective as an endocrinologist, what do you think could be happening here? I've heard that this has happened with other patients as well. Do you think a very low carb or zero carb diet like this can backfire for some patients, particularly when it comes to thyroid function and other hormone function?
Definitely. So the problem with the carnivore diet, and the carnivore supporters claim that meat has everything in it. It doesn't. So you're actually and it's not just about protein and vitamins. Polyphenols and antioxidants is something that our body needs. And when you deprive your body off of that, it becomes a problem. Also, they also support, eat grass-fed, grass-finished, but who can afford that? 80% of Americans probably cannot just buy regularly grass-fed, grass-finished. And that's another problem, right? People buy just cheap meats, but also, they're like, hey, I'm in a carnivore and I'm tired of this regular meat. Let me just go get some processed meats, deli meats.
Yeah.
And now you're going really wrong direction. So we really have to understand what carnivore means. It's not the same type of practice done by everyone. But even if it is done correctly, let's say you're eating grass-fed, grass-fish, everything is great, never touching the daily meat, you're still missing out on the antioxidants and anti-inflammatory substances in the vegetables. But also you are depriving your body of glucose or carbohydrates, so your pancreas function. Anything in the body that's not used will atrophy. Right. So as a result, when these people say, "Oh, yeah, it's Christmas, let's just eat some desserts," and then the next thing they know, their blood sugar is 400. It used to be maybe 100, 150, with the same type of food. Now they are hitting the 200, 300, and they are even being diagnosed with diabetes. So there is actually a lot of studies that suggest that the carnivore type of diet can actually lead to diabetes.
Wow.
So that's one explanation. But the other explanation is also the microbiome diversity in the gut diminishes significantly because the microbiome that lives in our gut, that is outnumbering us, by the way. The bacteria that's in our gut is number-wise, there are more numbers than our body cells.
Right.
So, and they need to have a good community. So when you shake that, and then they need all this prebiotics from the plant-based fibers and so forth. And so in carnivore diet, there's not a lot of fiber. So as a result, this microbiome changes leads to a cardiovascular disease, inflammatory problems, and diabetes as well. In the short term, I think what people don't realize that, just because you have a short-term gain does not always reflect a long-term benefit. So, and they see that, oh yeah, I've been a carnivore and my blood sugars are better. By the way, it doesn't happen to everybody because protein can also increase your blood sugar. And if you are eating a lot of saturated fats with the protein, you will still remain insulin resistant. But there are a lot of people who will have success, their inflammation will go down. But my hypothesis in that is that the reason your inflammation is going down is not because you stopped eating healthy vegetables, is because you stopped eating junk.
Yeah.
At the same time. So that is where I think the misunderstanding happens. And there are doctors on YouTube misleading patients, saying that is the only diet that a human should eat, a proper diet they call it. But there is no such thing as, first of all, people, and I believe in that, not everybody, based on your ethnic background, genetic background, your dietary needs will be different. Saying that all human beings should be carnivore is just false to begin with.
I totally agree with that. I feel like, we have to consider genetic differences between all of us. Everyone's got different things that they're going to be more inclined to need than others. And it's unfortunate, the thing that you hear a lot in the carnivore community, which I have a lot of respect for the people who are trying to better their health through diet and lifestyle. But the unfortunate mantra you hear a lot from the carnivore people is that if someone comes forward, someone like me who says, I've been doing this dedicated for 9 months and my thyroid levels are dropping, my sex hormones are dropping, I'm exhausted. Why? And they just say, carnivore harder.
Yeah.
You're not doing it right. You're not doing it hard enough. And that unfortunately happens a lot to thyroid patients. I see who's, their T3 levels drop. And if you're watching this and you don't know what I'm talking about, I did a whole episode where we talked about T3 levels and how T3 is just critically important to your vitality and energy and function.
T3 is the only hormone that your body actually can use as a thyroid hormone. So yeah, extremely important. So, but when their inflammation goes up, your body produces more reverse T3 instead of T3, and that actually blocks the action of T3 even further. But to your point, yes, definitely, it's not very suitable for thyroid patients for that exact same reason.
Yeah. Well, with that, let's segue then into treating thyroid nodules with non-surgical treatments, which patients love this, because so many people today are saying, I do not want to have my thyroid removed. And, they want to preserve their thyroid. And that's what thyroid RFA can do for patients. I'd like to take a moment to thank the sponsor of today's episode, RGS Healthcare. RGS Healthcare has been a leading medical imaging equipment distributor for more than a decade. RGS is known not only for recommending personalized medical equipment solutions, but also for offering continuous support to ensure success. One thing RGS is particularly known for is unparalleled physician training and on-site staff support. They are the only medical equipment supplier known for accompanying their doctors to exclusive, specialized thyroid RFA physician training on live patients proctored by leading world experts. If you'd like to learn more about RGS Healthcare, please visit their website, rgshealthcare.com. A heartfelt thank you goes out to RGS Healthcare for supporting this channel. Now, back to the podcast. So, how did you first get involved in offering this procedure? How did it complement what you're already doing?
I always wanted to do RFA, even like, when it first came around, and I was an employee of a corporate. So when you're an employee, not anymore. When I was an employee, it's you have to jump, and it's a big corporate. You have to go through so many people too. And if the
Yeah,
insurance is not paying it, they deny you immediately. Insurance is not paying it, you're not doing it. And you're not private, so you cannot charge cash. So I was like, I always wanted to do it, but then I got into private practice. I'm like, yes, now I can do whatever I want. And then it was the right time that, I heard that, Medicare will start covering this. I'm like, that's great. Then, maybe I can invest. Because a lot of times, from a doctor's standpoint, from a business standpoint, you're investing into machinery, you're
absolutely.
training, etc. Like, is this gonna pay off, or is it gonna
Mhm.
really help me or whatnot? So so since the insurance coverage came in, and I was in private practice, and I knew that was the way to go. It was always a hard conversation with patients. That's your only option, and you're gonna need thyroid hormone replacement later. Like, they were asking, like, there's no other option. Like, can you
Right.
not just take the thyroid nodule out? Like, when they do the surgery, right? Even if they do lobectomy, they don't just scrape your nodule out, they just take the whole side out. And
Right.
even then, 20-30% of people with one side of the thyroid still need thyroid hormone replacement,
Mhm.
especially if they have underlying Hashimoto's and whatnot. So now there is nobody who says no to RFA because it's a no-brainer.
Yeah.
Hey, you have a 3 centimeter nodule. Do you want to go
Mhm.
to surgery, or you want to do this non-surgically with no scar? I don't think anybody will say, I'll just go to surgery and I'll just have a scar and I'll risk it for my vocal cords and all that. Yeah, that's not been happening. But the problem is, and I thank you for that, for so much for doing this, because RFA is still in an infancy, so a lot of
Mhm.
people don't know about it. Primary care doctors don't know about it. They
Right.
refer patients to ENT doctors who are surgeons. What are they going to do? They're going to do surgery unless they have interest in RFA, but they end up still with surgeries because doctors are not aware of it. So,
Mhm.
but patients are smart. They research it, they
Yep.
find it, and they come to you. And that's what I'm trying to do as well in my social media and on my website as well, that we offer that. But since I'm a thyroid doctor, I see a lot of thyroid patients. I do a lot of RFAs just because if you're seeing 10 thyroid nodule patients, 1 or 2 end up needing RFA.
Mhm. Yeah. And what has the response been from your patients that you have already? And have you also had people coming from outside of your practice who found out, hey, this guy's offering RFA and I want to have it done?
So yeah, I had an interesting experience about that. So I had a very young individual, very nervous, anxious, and he had a cancer, a
Mm.
thyroid cancer, and he said, "I researched this. I want this procedure done." And that was a long time ago. And I now the are guidelines that allow you for certain low risk cancers to do
Mhm.
RFA. But I didn't feel like he was low risk. I had to try really hard to convince him to go to surgery because I didn't want to do that for like a larger thyroid cancer. But
Mhm.
yeah, people find you for that. But the people that we have done RFAs, when they come back in a month, I get surprised how much improvement they have in their symptoms, and then how much the ultrasound shows shrinkage just within a month. It's amazing. And then obviously in 3 months, 6 months, 9 months, you see the maximum results. And the procedure is only like 5 to 10 minutes of energy time, delivering energy, and there it takes an hour of their time on that day. I mean, you can't beat that.
Yeah, yeah. And it's wonderful because at the end of it all, you're still going to have your thyroid gland and you're still going to be able to focus on all of these lifestyle things that we've been talking about
Exactly.
that are going to improve your health overall versus having your thyroid removed. Once it's gone and you can't do the same things to try to support your
And
health.
patients don't feel the same. We used to
No.
tell people, yeah, if your levels are okay, you'll be okay. You're not going to feel the difference. They gain weight. They don't feel good anymore. There's all sorts of complications happen after removing the entire thyroid.
That was absolutely a top priority for me with my situation, because when I had my thyroid nodule get really, really large, it was actually kind of a sudden thing. I had a 45 cc nodule, and then I took some antibiotics for a UTI, and I had an allergic reaction, and then my nodule just like massively expanded, like very quickly, like within a week or so. It went from being tolerable but annoying to I can't live like this anymore. And like I said, it got up to 75 cc's. So I was miserable, and I was thinking, okay, maybe I have to consider surgery. But I was terrified of the idea of losing my thyroid because it was still working and it was still totally functional. And I'll just do this one little side story, because I had knee surgery when I was 18 years old. I actually had to have 2 surgeries within a week of each other, had severe complications, severe systemic staph infection, was in the hospital for a week, really, really sick, really, really, really unhealthy as a result of all of that, and had to drop out of school, and just life trajectory changed completely because of that surgery. And so for the last 25 years, I have been dealing with the knee that I have from that surgery, and I've had to be really conscious of my weight. And so thinking about losing my thyroid gland and potentially gaining weight scared me a lot. And it wasn't for vanity purposes. It was because of my knee, like being in so much pain from both my pregnancies from the weight gain. And there's so many other reasons. That's just one of the myriad of reasons why I chose RFA. But people always ask me, do you have any regrets? Do you wish you'd done anything different? Absolutely none. I have no regrets. It was the perfect solution for my situation. And so many patients agree. We have 14,000 plus patients in our Facebook community. So, and we're growing constantly. So that's the side story. So let's talk about candidacy for RFA. Who makes an ideal candidate, and when should someone consider this procedure, maybe even if they don't have symptoms?
So the ideal candidate, obviously someone with a thyroid nodule, 2.5, 3 centimeter or more, and less than preferably 4 centimeter. Although it's not a contraindication, sometimes I tell patients if it's a 5 centimeter nodule, it may possibly require 2 RFAs. But in most cases, it's just 1 RFA. But it is easier to handle if it is less than 4 centimeters. So 2.5 to 4 centimeter nodules are the sweet spot. And then symptomatic patients, obviously, like if it is on the left side, pressure, coughing, swallowing dysfunction, or just a feeling of this big lump in their neck, every time they swallow. So breathing, even like trachea compression, right? However, when patients don't have symptoms, then they come back and it was 2.5 centimeter, now it's 3 or 3.5 centimeter. I'm like, look, maybe you may want to do something right now, because yes, you can wait and see, but I don't see it shrinking. It's just keep growing.
Right.
And the bigger it is, the harder it's going to be to deal with. So maybe it's right time right now to take care of this. So definitely expanding growing nodules are a candidate, not like in the 1.5 centimeter range, obviously, but once they hit 2.5 centimeter or more and they're growing, definitely you can have a much better success. I mean, 95% reduction in that nodule size, which means that it's going to almost disappear. So yeah, I think those are the 2 places that we find RFA very helpful.
And I agree with you on being proactive, because once these nodules get a certain size, like my nodule I was explaining a moment ago was 75 mLs and amazingly shrank 90%. That's very unusual. Most nodules that are that large don't shrink that much. The larger they are, the less they do shrink. The smaller they are, the more that they shrink. And so if you are a patient who has a nodule and year after year you're having ultrasound monitoring and it's growing, I would encourage you to be proactive about that, because once it does start to impact your quality of life, it is Very, very impactful. So let's talk about more complex cases. So a patient with multiple nodules, like a multinodular goiter, or even hot nodules. These are autonomously functioning nodules or those producing extra hormones.
Mhm.
Do you feel RFA could be a good option for some of these patients?
Hot nodule, definitely. They're a little bit harder to do RFA because it's more vascular and all that, but it is a way to basically cure the patient with just one single procedure. Most of them see results within 5 to 6 weeks. So that's why I always do a nuclear scan to see if the nodule is hot or cold, in addition to doing a biopsy. But yeah, hot nodule is one. If they have multiple nodules, it can be done for both sides, not at the same day. Obviously, it's going to require 2 RFAs. So if they're okay with that, we can definitely do that. The only time that I tell patients, look, I think this is a little too much for RFA. If they have this 3 to 4 centimeter nodules all over, like 4, 5, 6 of them, and it's like they're on top of each other, and their neck looks like a watermelon, then
Yeah.
I'm like, that's not a good situation for RFA. But bilateral is okay as long as it's done on separate days. If there's only like 2 to 3 nodules you're dealing with, let's say there's 1 centimeter one that's on the corner, doesn't bother anybody, and then you have this 3 centimeter on each side, you can definitely target them separately.
Mm-hmm. Yeah, and I think that there was often in the past kind of a misnomer that patients were being told, "Oh, well, if you have more than one nodule, you can't be treated because it's just too complicated." But that seems to be kind of fading out of fashion, hopefully.
I mean, look, in the past, I have a lot of patients, even like decades ago, they come and the surgeons used to remove any nodule, everything they
Right?
saw. Uh, so now we are very selective. There are patients that we don't even go to surgery, even with the cancer. Somebody with, like, let's say 85-year-old, and they have a 1 centimeter, 1.5 centimeter cancer. Like, we have a discussion with the patient. Do you really want to do this? Because the thyroid cancers are so slow, growing
Mhm.
anyway. And, these nodules, most of them are benign and it doesn't bother your thyroid function. They are not cancerous. So what's the point of touching them, right? So you may have 5 nodules, right? And then one of them maybe is large,
Mhm.
and maybe that's all you have to deal with. So
Right.
because of it is sheer size, but having 5 other small nodules does not prevent you from getting RFA because they're not really doing anything to you.
Right, right. That was actually me. It was just one really big, massive one, and all the rest of them didn't even know they were there. Still don't. So, okay, well, then let's walk through a procedure in your clinic from the patient's perspective. What do they experience on the day of the procedure, and what is their recovery typically like?
So we obviously have them read about the consent. We go over certain things with the patient before the assistants do that. But yeah, so we generally tell them to come in, obviously with no metals on their body, and so that we can easily prepare them for the time's sake. We also give them a little bit of a Xanax or something like that because it's a fairly long time, to 30 minutes laying down on a table, on an exam table. It can be, difficult. So we give them some anti-anxiety medication. But then obviously we tell them after, post-procedure instructions, keeping the ice on for a day. Tell them, if you want to call it a downtime, you can, by putting ice, but it's really not. You can still do things with the ice pack on your neck without obviously having doing physical activity or strenuous activity. But yeah, so it's fairly straightforward. They just come in and just walk in, and we prepare them in less than 10 minutes, and they're on the table, and within 30 minutes they're out. And we obviously, when they come out of the procedure, we take them to a room, let them relax a little bit, let the Xanax go away, the anti-anxiety effects go away. And also we tell patients to bring someone with them to drive them, because we don't want to give somebody Xanax and let them drive. If they're not used to it, it's going
Right.
to be a problem.
Yeah.
But yeah, that's fairly straightforward preparation.
Yeah, and it's great that patients can have that done and then go home, and basically, with a few caveats, basically go back to their normal life. At the time when I had my RFAs, my two girls were, let's see, I think 2 and maybe 8. So, still little kids.
Mhm.
And I came home and I was a couple days out because I had my procedure done actually in another state. I live in Alabama and I went to Virginia because that's where it was available at the time. It wasn't available here. So it was a day or two later when I got home, but I was able to pick up my little girl and hold her, went over to visit my sister and held her little girl. And it was like, basically I just kept the ice pack on and took breaks from time to time, but I wasn't down for a week, like people talk
Right.
about after thyroid surgery. They have to take a week off of work and they have to be really careful about their incision and all of those things. So it's great to have this non-surgical outpatient option that patients can have and then also shrink their thyroid nodule and preserve their thyroid gland. Let's talk
Exactly.
about the results. So what results can patients realistically expect? How much shrinkage do you typically see? And you alluded to this a moment ago. How long does it take?
So in general, it goes from 50% to 90%, right? So the 50%, like you said, if it is a very large nodule, 5.5 centimeter, there may be only 50% shrinkage, which is still significant, because if you think about it, at that size, if it goes from 5.5 centimeter down to 2.5 centimeter, it's going to be a whole different ball game, especially if the patient is symptomatic. But for smaller nodules, say 3 centimeter nodule, that's probably the one that will get the 90% reduction within 9 months. That's what I tell my patients. Interestingly, it doesn't actually stop there. Studies are done at that certain time points and they cut the study off at some point. But when they follow up on these people, they actually continue to see shrinkage in the thyroid nodule. I also tell them, there is a potential growth can happen later, but we don't know if will happen. Most of the time it doesn't happen, but if it does happen, it may be 5-10 years from now, and you may do another RFA at that time. So it's not since the procedure is so benign, it's not a big deal to repeat it down the road if it doesn't shrink enough or if it grew back.
And we see patients all the time who say, I would much rather do this kind of almost for maintenance, once every 5 to 10 years than have surgery. And there are some patients who would say, oh, I just want to do it once and be done with it. But there are a lot of people out there who want to preserve their thyroid. And like you were talking about with the large nodule and 50% reduction, that is absolutely true. In my case, at the 3-month mark, I had 50% reduction and I was absolutely elated. And it just kept on shrinking after that. But at that point, I was totally happy and would have been happy if it didn't shrink any further after that. Because when you have this massive nodule and it's creating all this pressure in your neck and it's creating issues with your swallowing and your breathing, having a 50% reduction is amazingly life-changing. So if you're watching this and you're thinking 50%, that's not, I'm looking for 100%. You have to kind of reframe your thinking about this because we're not ever going to fully disappear a thyroid nodule from shrinking it. The only way you can fully disappear it is to have it removed, right?
Right.
But if you shrink it down enough that it's not creating all of these symptoms in the neck, it is life-changing.
And some people say that I just want it to go away. I don't want a nodule in my neck. I tell them, look, show me your arm. You see those moles on your skin? So what do you want to rip them off? You don't want to do that. It's going to create a scar. So they look benign. They're not cancerous, so we don't touch them. So why do you want to touch every nodule or why do you want them gone if they're not doing anything to you? Right. So let's say it goes from 4 centimeter down to 1 centimeter. Well, it's not bothering you anymore. That's the whole point, right? And you can live with it, just like having a mole on your skin. You have a mole in your thyroid.
Well, let's talk about one of the biggest hurdles for patients, which is the cost and navigating insurance.
I do run it by the insurance for my RFA patients, and we obviously offer a cash option if the insurance doesn't cover it. But interestingly, we got it covered, I would say 80% of the time.
Wow, that's
even
amazing.
with the commercial payers. I had patients from Aetna, Cigna, and Humana. So Medicare covers it for sure. That's if the Medicare is primary, that's great. But we see a lot more coverage from insurers. Well, they don't pay great, obviously, but it's what it is, and I rather do that for my patients than putting them in a financial hardship.
Yeah.
But yeah, in my practice, if the insurance does not cover it, we charge $2,500, which is on the low side if you look at
Yeah.
across the country. So we are very reasonable with our prices in our clinic.
Wow. Yeah, that's incredible. Yeah, I was thinking where I was going with the question was because you talked about insurance a moment ago, but I was thinking that you probably had your patients submit on their own to their insurance, because now we do have a code for in reimbursement for insurance of thyroid RFA.
Mhm.
But so does your practice actually submit that on behalf of the patient?
Yeah, we do.
Wonderful, wonderful. Yeah, that's a common frustration for patients, is dealing with the insurance bureaucracy, because
Mhm.
it's not easy, and oftentimes it can be very
Time consuming.
tedious. Yes. So wonderful. Well, we're kind of getting to the end of our time. So let's just say, what is one key takeaway you want to leave with the audience today, that person who might be struggling with a thyroid diagnosis or a metabolic diagnosis?
So for thyroid, I would say know your options, understand the RFA and the other options, but there is really nothing to be scared of the RFA. It is very safe and effective procedure. And then obviously when it comes to metabolic health, the thyroid nodule could be an awakening for a lot of patients to reassess overall their health.
Totally agree.
Because even if you have thyroid cancer, to be honest with you, is one of the best cancers you can have. So you just remove it and you're done. But if the same pathology that leads to thyroid nodule could lead to a lung cancer or a prostate cancer or anything like that, which is not always easy to deal with, and it kills people all the time. So by reversing the insulin resistance, understanding that there's a connection, I think is a good wake up call for a lot of people.
Absolutely. Totally agree with that. I think that patients that I see frequently are on that journey. They want to know how they can improve their life, because this, like you said, is like a wake up call for them. So I would love to reframe it from it being this scary unknown to it being this catalyst for helping a patient to make all those moves in the right direction with their health. And that's one thing I love about your YouTube channel, is how you kind of frame all of the metabolic stuff in a way where it's like more empowering for that patient than this scary or difficult diagnosis. What is the best way for patients to reach out to you?
So our website is tcendo.com, tcendo.com, and our phone number is 772-398-7814. They can text that number, or they can call that number and request a consultation. That's all they have to do.
Awesome.
They can also do the same through our website as well. They can just request a consult directly from the website.
That wraps up today's episode. If you found this valuable, please like, subscribe, and share it with someone who might benefit. You can find links to everything we discussed in the show notes below. Find a physician, discover treatment options, and join our patient community at saveyourthyroid.org. To stay up to date on new episodes, resources, and expert insights, be sure to subscribe to my mailing list at saveyourthyroidwithjen.com. It's the best way to stay connected and informed. There, you can also find all podcast episodes and book a 1-hour patient navigation consult for personalized guidance on your next steps. As always, please remember this podcast is for informational purposes only and is not a substitute for professional medical advice. No endorsement is given or implied for any specific product, treatment, or physician mentioned. As always, consult with a qualified healthcare professional for your individual needs. Thanks for listening, and I'll see you next time.